5-Minute Pearls for Clinical Practice. Today's pearl is called anticipation. Hello, this is Dr. Brian Morris, and this is 5-Minute Pearls for Clinical Practice, where you will learn the tools to provide exceptional care for your patients. This is the weekly podcast where you will be introduced to time-tested, evidence-based patient care strategies that aren't always taught in schools or training programs, but are nonetheless crucial for success in clinical practice. It's funny how we learn things from all sorts of interesting places. Sometimes we learn things from traditional places like lectures or courses or even online programs. But sometimes we learn important concepts at unexpected times from unexpected sources. Last year, my wife was diagnosed with breast cancer. We learned a lot during her treatments, during the surgeries, during the chemotherapy sessions, during what was a very, very difficult year. Fortunately, we were blessed with an extraordinary medical team that included 2 great surgeons and a wonderful oncologist named Dr. Shay Ashuri at UCLA. While my wife was in the midst of chemotherapy, I can remember a time when she was not feeling well. My wife was having a low-grade fever. She was just feeling weak and tired. She told Dr. Ashuri about this while she was at the office having her standard chemotherapy regimen. And she went home, and the next day, Dr. Ashuri called my wife to check on her, to see if she was feeling okay, probably to ensure that nothing had changed overnight that might necessitate a new medication or an antibiotic or some other adjustment in her treatment regimen. I thought about this recently as my wife mentions this to me occasionally as being something that meant a lot to her, that Dr. Ashuri on his own just called her to check on her. And I realize now that Dr. Ashuri was practicing a very important tool that I want to discuss on this podcast episode, anticipation. He wasn't waiting for my wife to call with a worsening problem. He wasn't just hoping that everything would work out okay and that she would be fine. He was anticipating. He anticipated that there could be a problem and that by calling her, he was taking an important step to check on her status. Anticipation or proactivity is crucial in clinical care. The opposite of anticipation is reactivity, which is by definition passive and usually not that helpful to patients. More helpful is to be proactive, to anticipate what might happen, and to take the necessary steps to stay ahead of the curve. This doesn't always mean that you need to call a patient every time. Perhaps you ask someone on your staff to call a patient. Perhaps you use an encrypted message system to electronically stay in touch with your patients. However you do it, you should always be thinking ahead, anticipating what might happen and what you could do. How will each decision that you make impact your patients? What problems could occur? What issues might you be thinking about or looking for? What could you do to anticipate negative situations that might occur? Anticipation is crucial. We don't want to simply be reacting to problems in clinical care. In clinical practice, we want to stay ahead. We want to be thinking 2 or 3 steps down the road. Great sports coaches know this. Coaches like John Wooden or Bill Parcells or Pat Riley or Tony La Russa have taught about thinking ahead in sports, thinking 2 or 3 moves down the road. And this applies to taking care of patients as well. Be proactive, anticipate the future, always be thinking several steps down the line. By anticipating the future, you will be making your patients' health care that much better. Let's keep the dialogue going. Let me know what you think of this week's Pearl for Clinical Practice. You can email me at drmorris@5minutemd.com. That's DRMORRIS at 5minutemd.com. You can post your comments and your experiences on the 5-Minute MD Facebook page. You can follow us on Twitter at Brian Morris MD. And you can visit us anytime on our website, 5minutemd.com. Let your friends and your colleagues know about the podcast and make sure that you are subscribed on iTunes. When you are subscribed on iTunes, you will receive new podcast pearls as soon as they are posted. And if you have a few minutes and you enjoy what we're doing here on this podcast, please head over to iTunes and leave us a review. Thank you so much for listening. I will see you at the next 5.